When we talk about somebody going into medical needs in retirement, do you know the number is a $400,000 retirement surprise? Are we talking about an average number for people and what they have to spend in retirement?
That is the average cost that a retiree spends in health care over their lifetime of retirement. That is the average cost.
And retirement used to be 10, 15 years. We're now going into 20, 30 years.
Yeah.
The inevitability is this number's going to grow.
Yeah, well, the costs grow, healthcare grows. The thing that, the industry, I think, didn't account for was the advances of technology and medicine and how they keep us alive longer and longer and longer. Like, life expectancy continues to grow, which is why mortality tables change. And mortality tables are basically actuaries telling us what is the average life expectancy over a specific time frame. The average life expectancy today for a newborn is over 100 years old for a newborn today.
I honestly had not heard that.
Yeah, it's over 100 years old. For a newborn today, with the advances of technology and medicine, are we going to continue to get better? Are we going to will technology continue to increase? Will medicine continue to get better? It always has, it always will. We will find new scientific discoveries and so on and so forth. That's the way that we are built as a people.
Okay, you do this every day.
Yeah.
How many people walking, this is probably a rhetorical question because you're just going to laugh. How many people walking into your office have any idea that it's going to cost them $400,000 in retirement?
Yeah, that number would effectively be zero. Not a single one.
Kind of what I thought.
Takes that into consideration because there's so many what ifs and nuances and how all of these things come together. How do we even get to that number? Well, living longer than we, expected. The reality of the world that is unfortunate is we don't get younger and healthier over our lifetimes. That's just not how it works, unfortunately. A lot of people get into these situations to where I'm eligible for Medicare, per se, right? I just turned 65, I'm eligible for Medicare. I don't really go to the doctor. I'm pretty healthy. I don't want to pay for it if I can. So maybe I select the Medicare Advantage plan, per se, right? And not understanding how those plans work and where the kind of pitfalls can happen, not understanding the max out of pocket, not understanding the difference between HMOs and PPOs and the $6,700 cap versus the $10,000 cap in and out of network, not understanding long-term care costs, not understanding IRMA and having to spend money down in a situation because of long-term care, which then triggers my Medicare to be over $500 a month because I'm having to spend it down that fast. There's all these nuances that can happen, and this is why it's an average, because one thing that is for certain is life will continue to happen. Things will continue to pop up.
Man, you give a long list. How do we start unpacking that? Because let's be honest, we want to do, especially as we get older, we'd like to do easy.
Yeah.
So I've kicked the can down the road on a lot of things in my retirement plan, and I certainly don't want to talk about medical issues because that's cost me a lot into this. How do I begin unpacking a strategy? There's nothing more that you preach than having a plan.
Absolutely.
So how do I begin a plan if I know today, ignorance is no longer your excuse, your average cost in retirement is going to be $400,000. How do I begin a plan for that if I'm throwing that out?
Well, it's sitting down from the moment that I have the understanding that, hey, I need to do something. And so many people just take into account that, I got a Medicare, I got a Medicare plan, I got a Medicare, and not understanding all of the other moving pieces. Medicare doesn't cover long-term care. Too many people, I was in the military, right? Maybe I have TRICARE for life. Maybe I have VA benefits. Understanding they don't cover long-term care. Too many people have this misconception that everything is covered in every direction. And it's simply not true. When you are first eligible for Medicare, Medicare is broken down into two parts. You got Part A and Part B. Part A pays the hospital bills. Part B pays the doctor bills. Part A, they will have specific copays. If I go to the hospital anywhere from 1 day to 60 days, Medicare is going to require a copayment. Right now, that copayment is approximately $1,600. So if I go to the hospital and the bill is $2,000 when I get there, there was some type of emergency, $1,600 is mine immediately. Then Medicare will pay the balance of anything more for that 60-day time frame, but I got to pay the first $1,600 out of my pocket. Remember, it's 60 days, right? I'm a numbers guy, so let's do this quick math.
Okay.
It's a 60-day time frame. So the question I get is, well, if I come out of the hospital and then I go back, let's say a week later, do I have to pay that $1,600 again? No, you don't. But if it has been 60 days since the last time, then yes, you got to pay it again.
Resets.
Correct. So how many 60-day periods do we have in a year? 60 days is 2 months, so there's six months out of the year.
Yeah.
That means I could have to pay that $1,600 6 times in a year, because that's how it works. That's Medicare's rule, and it is the same for everybody. Medicare is a federal program, not a state program. It's federal. So it works the same for everybody. First 60 days.
So what you're saying is people with chronic problems who are doing this, because you get older, you get out, you get bad again. You get out, you get bad again.
Yeah. This is what happens. People that don't have chronic problems, we just stated it, we don't get younger and healthier over our lifetime. And this is why that average cost is so high. Because you say, oh, well, you know, I'm pretty healthy, I don't know. But what happens when you have a bad year? What happens when that comes up? Now you've got all of these copays. Now that's just the first 60 days. 61 through 90 days, they're going to start charging roughly $300 per day. Once again, Medicare will pay the balance, but I got to pay the first $300 every day that I am in the hospital.
Every day?
Every day. So if I had a heart attack, a stroke, or something that required me to be in there that long, they're going to start charging me that every single day. This is just the hospital charges. This ain't the doctor charges. I ain't even got there yet.
Everybody going in thinks that that's what, here's what I've been told. I get to 65, I get on Medicare, I don't have to worry about my medical expenses.
Yeah, and that's for the people who don't know Medicare, that didn't have a plan, that don't understand it, or didn't get educated about it correctly. Everything I'm telling you is all in that Medicare and You book, and it's, you know, it's 200 pages long. I know everybody's going to read it cover to cover when they get it. Realistically, people want to understand, what do they pay and what do I have to pay? So I'm educating you on that now. One thing that I have learned about doing this show over the past couple of years is I'm an educator at heart.
Yeah.
And I want people to understand these things and why it's so important to have to put it together. So what I actually did was, I do this show often, you know, we're on every week. And when I see people out in the community, I get a lot of questions about, well, what does that mean to me? I heard this on your show. What does that mean to my situation? How does that affect me? So what I did was I started putting on small workshops around my own community to where I could get out and answer exactly those questions. So I want you guys to know, if you go on my website, spfadvisors.com, Strong Point Financial, spfadvisors.com, and you look for live events, there's live events in your area. Come out and see me, please, because I just want people to understand, to get the education, to know the right questions to ask, to put the stuff together correctly. So when I started putting on these smaller workshops, I could do exactly that. They're not sales events. It is an educational opportunity for you to be able to ask questions and get answers to those questions at the live events. So going back to this situation, we've got all of these different time frames. That's 61 through 90. 91 through 150 days, it's almost double. It's almost $700 per day. And those are called your lifetime reserve days, meaning you only get those once in your lifetime. Once you use them, you lose them. They don't come back, they don't renew. It's not an annual benefit, it's once in your lifetime. So if I had, God forbid, I had a stroke and I was in the hospital for over 90 days, Now I'm dipping into my lifetime reserve days and it's costing me over $700 a day, and I'm still not talking doctor bills. This is just the hospital cost, right? Most people aren't in there 60, 90, 150 days, right?
I mean, we hope.
Yeah, an average hospital stay is what, 3 to 5 days. If they do want to keep you any longer, as long as it's not a life-threatening condition, they'll switch you to a skilled nursing facility or or an extended care facility.
Okay.
How Medicare will handle that, this year, the first 20 days, they'll cover all costs. You don't pay anything for the first 20 days. Usually, they'll try to get you out of there before that 20 days is over. We like to say
Because they're not making money.
Yeah, they want to treat you and street you. They try to get you out of there pretty quick. However, let's say I had a stroke, or I had to get knee surgery or shoulder surgery. If I got to do rehab, that's where I'm going to do rehab at, in a skilled nursing facility. So if I'm in the rehab anywhere from 21 to 100 days, they're going to start charging about $200 per day. Once again, Medicare pays the balance, but I got to pay the first $200 every single day for that time frame. If it crosses the 100-day threshold, they consider that long-term care, and Medicare or any of the programs associated cover no long-term care. Intermediate home care, nursing home care, they don't cover it. You have to pay all costs. And that's where people they miss the boat. They don't even know how that program works or why or what that is. It's all in your summary of benefits. It's all in that Medicare and You book that comes from the Social Security Administration. Once again, I know people aren't reading it cover to cover. Maybe I might be one of the only ones, but this is my job. My job is to be able to put a plan together for somebody and say, hey, we've covered the what ifs.